Live. 1, 2. It's saying live, but we
counting
only get
down.
a screen. No, it's counting up, but we only got a screen. There we go.
Yo, welcome everybody. Welcome everyone to
peoples.
another Two Transmits for show. This is the first one of the year for us, right, Blunt?
Yep.
Yeah,
First one of the year.
First one of the year. And we have a good show for you guys today, folks. We're gonna talk about Medicare Advantage, or some people call it Medicare Disadvantage. Yeah. And we're gonna get right into it. We have one person missing that will be coming on later about 7:30. We have here Ms. Marianne Pizzitola. We have Ann Hackett and her husband, correct?
John,
Yes.
yep.
And last but not least, Mr. Lloyd Archer. Welcome all of you, and of course, Blunt. What's up, Blunt?
What's good, man? What's good, Pete?
So we're getting right to
Welcome,
it.
everybody. Welcome,
Welcome.
everybody.
Thank you.
We've all had our issues and questions about Medicare Advantage. Last year, Blunt and myself, we did a show on this, and we pretty much were against what our panel is going to be talking because we were just unaware of some facts that I guess they were pulling the wool over our eyes. I'm feeling. And the more we listen to other videos and people coming on, the more I guess I'm speaking for myself now. I was like more aware and be like, wait, there's something more to it. So with that said, Blunt, if you got anything to say, and if not, we just
No, I mean it's important that I really hope a lot of people watch this, but it's important that people read the documentation that's going around, because people could say what they want, but facts is facts, whether you believe or not. And the facts of what's happening here is really eye opening, and it's sad to see the way this union is going about trying to do this. So I'm glad we got Lloyd Archer and Marianne and Ann here, and our next guest is going to join us later to discuss these things, because people need to be aware of what's actually happening, what's actually going on. And the problem that we're gonna face, and I'm pretty sure all you guys are gonna know this, is it for a lot of people, they're not gonna act until it happens to them. And the thing about what's going on now is you eventually going to retire. Well, at least that's the goal, right? So you want to retire in peace, and this is what this panel was trying to do, make it so that you retire in peace. So with that, I'm gonna leave the floor open for you guys.
one more thing, but do you have that picture from back then that we posted about about the Advantage? Remember that the page just showed all the highlights. Do you by any chance have it? Because I freaking deleted it from here.
You talking to me?
Yeah, do you remember when we did the show that we were probably talking negatively against the Medicare
Pete,
Advantage, and we had
this
that
is not the
picture
time. No,
Hmm?
I don't have it. I don't have
You don't have it.
No, man.
All right.
You tell me right now.
Well, I thought maybe you had it on the screen or something. Okay.
No.
All right. So with the panel, like Blunt said, open. Who wants to start things off? And let's go. How about we start with Miss Marianne? Miss Marianne. Let's go with Marianne because we've been watching her videos for a while.
Oh yes, awesome
And I
video.
was pretty excited that when I saw the email, I was like, All right, I couldn't put the name to the face until when she popped up before. I was like, oh, this is she is. So, uh, tell us a little bit about yourself in a nutshell, what you do, how long you've been doing it, that, and then just jump right into
Okay, great.
educating us.
So you're Brooklyn Pete. I guess I could be Brooklyn Marianne. was born in Brooklyn.
All right.
I lived there for a while with my family. We moved out to Long Island. I eventually started working with New York City Fire Department in EMS. And after I retired, I founded a small group after 9/11 to help 9/11 responders with 9/11 healthcare and FDNY EMS retirees. And that was what our focus was at the time, was to focus on World Trade Center healthcare, the Zadroga Act, because we were getting sick and developing illnesses that people didn't think our agency didn't think was connected to World Trade. Our members were getting very ill with very unusual symptoms. And so that was part of our advocacy, was to make sure that they got the care that they needed. And then we eventually got that bill passed. And of course, 20 years later, we're still fighting it. This started 3 years ago when the city of New York went to force all employees and retirees into Medicare Advantage. And we knew that we had always had a choice of healthcare plans. We always had 14 choices of plans for New York City retirees. And that was because we have a statute that protects us, that says that all employees and retirees that the city has to pay for our health coverage up to a certain benchmark. So no matter where you live, you have to have a plan. Most of the city's plans are regional. In order to provide you with care, you would need a plan that would cover you wherever you were if you were retired. Well, when they went to do this, we started a little organization that now today is a gigantic organization. We have 2 litigation attorneys, a tax attorney, a bookkeeper, an accountant. We are fundraising 3 different litigations at this point against the city of New York. We have won every level so far over the last 3 years. The mayor is appealing all of our wins, and we are currently in those appeal levels. The very last case, the last win that we had, was where a judge put a permanent injunction on them, forcing us into the same Etna Medicare Advantage plan and the same contract that you guys have. Our plans are a little bit different. There are some uniqueness to them, but we are basically in the same contract, so to speak. So I started running this with our organization. We have a very large group a very large team that helps fight this on all different levels, and we help educate other retirees like Lloyd, and bringing them on and helping them get on their feet, creating their organization, get their battle going, give them the tools that they need in order to fight back.
Nice.
Okay. So, Mr. Archer, want to say?
Yes. Well, I'm going to say this: Marianne is a godsend. That's
Yes.
She is.
Yes.
our superwoman, and I don't care what anybody says. If it wasn't for her, I don't know where we would be. But excuse me, everybody.
You need a moment. You need a moment.
Yeah,
We got you. Take your time.
I like that, but it's affecting me now and my family. So, let me get myself together.
We got your back. Don't you worry, Lloyd.
Come on,
We
we
got
got you, bro. Take as much time as you need.
We'll come back to Mr. Archer.
Maybe we should focus on Lloyd's face for views.
I'm doing this.
Yeah, he knows. He knows about
Right.
I got you.
We
Don't
got
you worry.
It's okay.
Mr. and Mrs. Hackett.
We're
Tell
all
us a
in
little
it
bit about
together.
yourselves.
Right. So my husband was the bus operator, and he was a former chairman of Kingsbridge Depot in the Bronx. I am retired, but you're all going to hate me because I was on the management side. I've spent, not at transit, I spent over 40 years in human resources and labor relations. And for the last 20 years of my career, I was the head of human resources and labor relations for the Metropolitan Opera. And I negotiated the union contracts. And I also sat as a trustee on four theatrical unions in New York on their pension, welfare, and annuity funds, keeping them viable for over 20 years. So I am a lover of the unions, even though I was in management, because I believe everybody should be treated fairly and with respect. And I am in for this fight because I also do know the attorneys representing the MTA, because they used to be our attorneys, and know most of their dirty tricks.
Amazing.
So I'm here to help in any which way. Marianne, as Lloyd said, is a godsend. I drive her crazy, asking questions, but she has pointed me in the right direction to look for information that Etna does not readily give people, and the language and things. And you have to remember, you're dealing with retirees. My husband and I are on the younger side of the retirees, but there are people much older and they really don't know. So when we saw this change, we knew immediately that it was a Medicare Advantage plan, even though the union never told us that. But I knew immediately, because if you've done benefits, you knew exactly what it was. And so, we're here for the fight. We have been spending a lot of time talking to retirees. Many retirees had no idea their coverage changed. We've been going to luncheons. We've been doing whatever we can to help people, because people truly had no idea that their coverage changed. They thought they still were in traditional Medicare, and it was a new Aetna CPPO card. Because if you've seen that card that they've sent us, all it says is Medicare PPO. It is a very deceptive card.
No. What took all of you to be able to catch this? Like, how did you get that information? Because
Well, again,
transit,
she said, like I said from the beginning, I'm better now. If it wasn't for Marianne helping us out and like educating us on what this was all about, and then I don't know where we would have been. Last week, I got a letter from my doctor. She's now at New York Presbyterian. I didn't get it from her. I got it from Etna. They said as of April 1st, 2024, she will be no longer in the network. So that means that I can't see her anymore. She's been my doctor for almost 15 years. And, you get comfortable with doctors. And to start over again, it's stressful. So she called me. Well, we did a teleconference, and she called me. She told me, I explained to her what went on. She said, well, what happened? She doesn't even know what went on yet. But now that John explained that New York Presbyterian all around is not going to accept this anymore, this is real, and people are still not getting it.
Right.
They're satisfied with getting $2,000 from option 2 or
not even that much.
Well, they do.
Yeah. Well, by the time it's taxed.
Yeah. Well, and phone calls that I'm getting, they still don't know about it.
Exactly.
The meeting October 6th.
Ugh.
They didn't even the top 4. They came into the meeting and then they just disappeared. And they left Etna there to explain to us and lie to us what this coverage did. It's supposed to be so enhanced. If it's so enhanced, you wouldn't be paying extra money for your prescriptions now. And
were you allowed to ask questions to them?
No, not really.
No. They ask you to write something on a card and put it in a bottle, and they'll pick the question out.
Well, we'll get back to that.
Well, they didn't even pick it, because I wrote 10 questions, and I knew the minute they read mine, they would not answer. And I cornered the Etna representative after the meeting, and she could not answer one of my 10 questions.
Wow. So let me ask you guys a question. Maybe this might be Marianne's expertise, but the significance of contract number H5522. This when I read this particular part in the court documents, and I'm like, what did they try to? You guys have to hear this. If you haven't read this, you have to hear what the significance of contract number H5522.
So that is the contract number that Etna has, where Aetna tries to choose a plan that has the most stars. The more stars the plan has, the more money they get from Medicare. How do they get those stars? It's kind of like when you take your car to like the dealership and they leave and they say, hey, if we did a great job, give us 5 stars. And then you leave and you get some call or you get a postcard and you give them 5 stars because you had a good service. That star is how they make more money. So you want a 4-star, 5-star plan. That means that supposedly the people in it are happy, and that then the insurance company gets more dollars from Medicare. H5522 is the contract. It's like based in Pennsylvania. There's not really a lot of people in it because the one that we all had before, H5521, you had it and so did we. That was a 3.5-star plan. People were complaining they weren't getting a lot of the services that they wanted right away. There were delays and denials of care. So what did they do? They took everyone and says, look, we'll give you this 4-star plan. Doesn't really matter, where the plan is based, but they gave you this new contract number, based it in Pennsylvania. Not a lot of people are in it. And they said it was 4 stars. Then the contract, like originally your union kept saying, our plan is better than that retiree plan. And when we started to break it down, it's the same darn plan. There's some little things that are different. Some of the copays are different. Your network is worse than ours.
Yes.
So this is why when we said it is the same. So it is a contract number.
Right.
Right. So my understanding of the reading was that was already litigated on before, and the judge was like, this is no good. And our union is trying to pass that on to, well, you guys union trying to pass it on to them now, like if it's something better. So it's kind of like bringing back up something that didn't go through the course before, but making it look like something is brand new now.
Or better, because that was the point. Your plan is not the cities, those city retirees.
Yes.
Your plan I did for you is better.
Exactly.
Right.
Yes.
But it wasn't. Or I heard those videos where Richie Davis was saying to all the actives, just sign this contract, ratify this agreement. This doesn't affect you, but it does.
It does.
It
does
affects
affect
you tomorrow, but it affects them today.
Right.
Exactly.
Right.
Exactly.
And this is where this is critical. You must identify as an active worker that they are your future. We are your future. We recognize that we were you. Active workers need to identify. You will be us. You should never diminish your future. We protected our future. We're urging you to protect your future and learn about how life changes once you become Medicare eligible, because this is your future. You reduce your benefits today, you are selling off your future. We're begging you not to do that. That's why this became as loud as it did. We wanted
And
to
selling out those that are coming up behind us as well.
Exactly.
Yes.
And this
well,
is
look, your job's hard, right? I mean, you got a really hard job. Your working conditions are hard. So if you have lousy pay, you have a lousy tier 6, and now you have lousy retirement healthcare benefits, who the heck is going to want to work for you? The city of New York or state or MTA. I mean, but that does that not make
where
sense?
are we so far with this that you are getting together? Where are we at? Because I heard something about MTA lawyers. They have someone that gets paid. They got a lawyer that gets paid $1,600.
Oh, that's cheap.
An hour?
Proskauer is one of the most expensive law firms in New York. They are top notch. They are national. They are top notch. They are the leading benefits and labor relations firm around. And they bill between, depending who their attorney is, anywhere from $1,300 to $2,600 an hour.
Jesus.
An hour.
And the lawyer that your group has right now, or is there one? I know that
there is a lawyer that we have right now. The papers he filed the papers last Saturday. I think the Transit Authority and Union has till March 9th to respond. All right. And as Blunt said, he looked into court docs. You should look at all the evidence that we have there. He's an excellent lawyer. All right. And getting to the lawyer part, I always got to get this pitch in there. This lawyer costs money.
Yes.
It's not cheap. I'm asking the Transit Authority people not to go to a party tonight or next Saturday. That $100 you're paying for the party, actives and retirees, please visit us on our website at www.tw100r.org and donate. You could do reoccurring payments of $50, but we have 740 people on this page. I figured it out that $200 a person, we wouldn't have to come back to you guys for at least a year, because it's going to be about 3 or 4 appeals.
Okay.
Can you repeat that?
Donations.
Yeah, repeat the email.
www.tw100r.org. And if you want to email us, it's www.twu100@gmail.com.
100r@gmail.com.
Right. You go ahead. You could say it, Ms. Agnew.
Now you can call me Ann.
Okay.
It's twu100r@gmail.com.
Correct.
And they do answer because I send stuff all the time, and they will respond, and somebody from the group will reach out to you if you have a question or need information.
Folks, for those of you that are watching right now, please share this. Very important information here that everybody should listen to. And my panel, I'm guessing you guys already shared this to your 2 pages you're allowed. So let's get this out there. So whether you're new on the job or you're about to retire, this is definitely something that should be shared out. So we actually let you do that ASAP. We're 20 minutes into the show. Let's share this out to as many groups, as many people. Put it in your own pages, because more than likely, if you're watching this, you either are with transit or you have friends or family in transit, or maybe on Facebook. So if you pass this information, because like last year, like Blunt and I, when we did this, we were pretty much in the dark about this stuff, and I feel like an idiot, to tell you the truth.
No, I don't do that.
They misled everybody. They just misled everybody.
Because you want to trust. What is it you call Blunt? You don't call them that name that you have for them. You don't call
officials.
them leadership.
Officials.
You call them officials. What?
Elected officials.
Elected officials. So we want to trust the elected officials, and they come to the depot and they tell us all these things, show these pamphlets, and we're like,
pretty
this is
pamphlets. And Richie Davis told you guys standing in the crew room, how many of you guys in here are retired? It won't affect you. His words, not mine.
Wow.
It won't affect you. There's only one retiree in this room, and he's now left the Retirees Association, and he's back to the tier 6 that's not going anywhere. All right?
That's a blatant lie, though. Like, how are you gonna say that? Okay, I'm sorry.
I'll send you the video.
I mean, at some point, people going to retire, right? So how is he saying it's not going to affect them? And anybody who sits there and listens to that,
they must be thinking they're going to leave before they retire.
Right.
Yeah, no way.
And the misleading started with, we got only certain retirees, not everybody, got from a newsletter in June called Senior Buzz. And Lloyd, you'll remember that. Yeah. And Senior Buzz was, oh my God, we have this wonderful enhanced benefit, and we're giving you new benefits and enhancing it. It never said it was Medicare Advantage, ever. And it talked about 99.9975 people, doctors and networks would be in this new Etna network. Then you heard radio silence for a while. And then we had the meeting in October, which was not readily communicated. And those materials were extremely deceptive. And then you had to wait for open enrollment in November, and half of the retirees never got materials. So they either got there were 2 packages that came out. They either got 1 of 2, or maybe 2 of 2, or none of 2. And so there was no real clear communication to all 33,000 retirees. And if you read through all of the materials, it's the generic Aetna language. They have their 10,000 caveats in it. They spent a lot of time telling us, the union, that nobody has this plan, which Marianne knows, the city all has it. The stagehands union in New York have the same exact plan. Everybody, that this was so unique, and they made it sound like you could go any doctor anywhere you wanted. And they forgot to send everybody this lovely 109-page document called the Evidence of Coverage. And that's really where you start to see where you have out-of-network coverage, but you're going to be paying a ton of money.
How can we get that?
The evidence of coverage,
Mhm.
I should have one.
Not me, like us in the show, like any transit worker. Is there a way that they can ask for that and get it?
Yes.
Marianne probably can answer that.
Yeah, so if you go on to the Etna MTA Transit website, there is a link for the plan documents. So that's how I found it. It was you had the evidence of coverage, or EOC for short, for 2023 and 2024. So I started to go through it. Your documents should all be up on that MTA Etna website, and then just start to look through those documents, and they're long, and a lot of it is it is some of it can be difficult to read. But what we started to do was go through it page by page, line by line, highlight parts that were concerning to us. What was concerning was that, for example, it doesn't even acknowledge that it's a Medicare Advantage plan until like page 8. As Ann had said before, it basically just says Aetna Medicare. So you're not understanding or seeing any red flags that this would be any different than maybe what you already have if you were in Medicare with a PPO. And because there's a lot of confusion, you'll hear like Wendell Potter is a very good whistleblower friend of ours. He always says Medicare Advantage is not Medicare and it's not an advantage. But most people inherently, insurance is confusing too. So if you say Aetna Medicare, they're not really going to know that they're in a privatized for-profit version of the public health benefit of Medicare. Many people don't even understand how your healthcare benefits change when you are on Medicare. And that makes it even more confusing. And that's why when they put this glossy purple brochure with red hearts and says, look at what we've got for you, and you've got benefits you don't have in Medicare, and we could give you dental, and we could give you a $200 gift card if you let me into your house, or a Fitbit, or rides to the doctor. You're going, ooh, score, that sounds great. But then they're not telling you on those glossy brochures the problems of the plan. Narrowed networks, you have to use their network. If you don't use their network, then you have to pay for that doctor up front if they won't take the plan for payment. Your contract actually says that, which what makes your contract provision worse than New York City's, in that your contract specifically states you must use the Aetna network. And if you don't get the proper authorizations to use an out-of-network provider, and that doctor does not accept the plan for payment, you have to pay for the doctor upfront, or they won't reimburse you when you submit the bill. So those are important things, because right now, today, you have a salary, your income, you might have a dual household. So when you retire, your pension is literally 50% of what you're making today. You have to prepare for that. Even if you put your Social Security on top of that, you're still on a fixed income, and your raises is called a COLA, cost of living adjustment. It's only between 1% and 3% of the first $18,000 of your pension. So most likely what you'll get a raise after whatever your provisions are, you're in retirement for 5 or 10 years, is just a couple $100.
Right.
And to case in point, I was told about 4 months ago that I've been on Medicare Advantage since 2019. So I asked BSC, can you please send me something that I signed that says that this is Medicare Advantage? So I went back into my computer and I've seen the open enrollment in 2021. And in the middle of the application, you see Medicare Advantage. I was dumb to the fact I didn't know what Medicare Advantage was. And probably most of the people that have retired in the last 5 or 6 years before this contract are on Medicare Advantage and didn't even know it as they were signing the open enrollment. And I guarantee you that they are. So now they said, okay, these people don't know. Let's just open the floodgates and push everybody into it. And I asked for them to send me the paperwork where I signed to be in Medicare Advantage. That was 4 or 5 months ago. I haven't gotten it yet.
And people don't understand it. But even look at this open enrollment. So you were basically told you didn't have to do anything. They were just going to put you into option 1. If you wanted to go into option 2, then you had to call BSC. And then somewhere buried in the documents
Absolutely
was, if you don't want to be in any part of it, if you really don't want to be in Medicare Advantage, you must call BSC and opt out, and then you can come back the following year. But if you do that, you are losing everything. You're losing your medical coverage, you're losing your prescription drug coverage, and you are basically going out after all those years you put money to aside, for giving up wage increases to fund medical coverage for you. And now you are forced to go outside, keep your traditional Medicare, and buy a supplemental policy to cover the 20% that, the 20% that Medicare doesn't cover, as well as buying a prescription drug coverage. So you're talking about, for the average person, they're probably, if they really truly needed to keep their Medicare plan, they're probably facing $4,000 to $5,000 out of pocket, right then and there for a plan. How many people can afford that when your pensions are probably, depending upon when you retired, between, let's say, $40,000 and $60,000 a year? How do you?
And to bring home your point, and that's pretty much a healthy person. Now
Yes.
imagine if you had something wrong with you.
My husband was being evaluated for a heart transplant, so he is in the Columbia Presbyterian heart failure program. And so, we came back, we moved to South Carolina 5 years ago because I had retired and he was retired a long time ago. He retired in 2009 when he had his first heart attack. And we moved to South Carolina. He became very ill down there, and the doctors told us that they were not equipped because he has such a complex case. And he also was a 9/11 first responder for the transit. He drove the bus for the body bags in the first day.
Oh, geez.
And so we made a decision because they told us we either had to go to Duke or Johns Hopkins or to the Mayo Clinic. And we made a decision to come back to New York, where our children and grandchildren are. And they honestly didn't think he was going to live. We came back in 2022. And so we came back. We are in this group in Columbia Presbyterian. They have done an amazing job keeping him going, and he looks good. But he requires daily care. He has 2 internal devices implanted into him that we pay Columbia Press Medicare paid for it every single month. And they monitor daily. And then they adjust his medications daily. And at the moment, they have decided he's not going to have a heart transplant, primarily because he has some issues from 9/11, from pulmonary issues. But still, he needs this care. I have oxygen in the house. Are they going to pay for this? I have no idea. But now Columbia is going out of network. Now what do? Does he die because of this? Because Etna is certainly not going to, say he's going to need the number of appointments that he has. He sees the heart failure team every 4 to 6 weeks. So what happens? That's out of network now. Are they going to say that that's, not there? And when you call Etna, and I call them and got some very lovely people. Their first word out of their mouth was, "Oh my God, but you are so," this is their exact language, "you are so lucky that you have the ESA plan, the extended service area plan, because you can go out of network anywhere and it will be covered as," but what they whisper is, as long as they accept the Medicare payment, the Aetna payment directly. And
That's the
so
fine- the little fine print, right?
yes, and I spent with everybody there, I did a math example for them to make sure. I said, I played dumb and I said, let's go through the math and how this all works. And when I went through the math example, and I said to them, so the doctor is not, they're going to bill Aetna. The doctor is $700 a visit. Aetna pays $226 for the visit. And we're going to be balanced bill. Well, maybe they won't balance bill you. And that's what they said to me. And I said, then why would a doctor go out of network? They're not going to accept Aetna, a Medicare payment.
It's too low.
Right. So this is what people are going to be facing.
So, for example, in your provider directory that I'm looking at right now, on page 8, it says you must use network providers to get your medical care and services. If you go elsewhere without proper authorization, you will have to pay in full. The only exceptions are emergencies, urgently needed services. When the network is not available, that is, in situations when there is an unreasonable or not possible to obtain services in network, out of area dialysis services, or cases in which the Aetna Medicare PPO plan authorizes use of an out of network provider. This is a problem because there are many places around the country that there are no network providers. And if your doctor does not, if Aetna does not provide a authorization, or you don't call for an authorization because your doctor's out of the network, they're not going to pay for this. This says that crystal clear, you pay. Right. So now let's say you submit that bill, you're having to pray that they find that this is medically necessary and reimburse you. You shouldn't have to go through that, especially when you're battling illness.
Right.
Right.
Yeah, I've heard quite a few stories since this started where people have gotten denied, people that have cancer and had to go for some certain treatments, and they've been denied. So, like, what happens? Are these people just going to die because their treatment has been denied?
Yep.
We brought that up in our case.
Yes.
Our attorney brought that up in litigation over the summer. He announced in court that there was a case of Arana Cunningham from Arkansas who had a specific type of a cancer. She went to go to the doctor for proton beam treatment. The doctor had to get authorization from Aetna. Aetna refused to give that treatment and denied her. Even though through appeal, the family ended up liquidating their assets, liquidating their home to try to pay for this proton beam treatment. That's the same treatment that I called with one of your retirees to Aetna to try to see if they would cover. And in a 2-hour phone call, they could not tell me that they would. It was dependent upon where the tumor was, and of course, prior authorization. So what happened to Arana Cunningham? She passed away. The family sued Aetna. And a jury found that Aetna was liable for $25.5 million for denying the care. And the judge even told Aetna, get your act together and fix this. When we brought it up in court in July, the Aetna attorney said, oh, pshaw, judge, don't listen to those retirees' attorney. That's just one person that died from prior authorization. And prior authorization saves money, he said. And so all of us in court, we were like, oh my God, just one person? Like, he just diminished the value of a human being's life. And the judge's face cringed, and he said, sir, to this court, if one person died because of a business decision by your company, that's one person too many. That's Aetna.
Let me just bring real quick the one that was waiting to come in, the one that was missing. Celso Garcia, we're going to bring him in. He said he had a lot to say, but he was not going to take too much time. So we're bringing him in right now. Mr. Celso Garcia, welcome.
Hey,
no relation.
Good. How are you?
You're hiding. Are you hiding from management?
No,
'Cause
I think
before
they
you
hide
see a
from me.
uniform, it's like you're all covered up, like you don't want no one to know who you are.
You don't know who I am. I'm undercover.
There you go.
Everyone knows who I am, but nobody knows who I am. You understand?
All right.
That's the way it works.
All right. What you said you had a lot to say.
I don't want to overshadow everyone because a lot of
Go ahead.
people don't like me because of where I speak. I've been in politics since I was 5 years old. I'll tell you that right now, okay?
Yeah, tell us a little bit about this real quick.
I know who Dinkin is. I know all these people, okay? And the reason why I've been in politics since I was 5 years old is because my family would get together and talk about politics since I was 5 years old, and I would hear these conversations, and I didn't understand at the time what was going on about the local, the national, the international politics that were going
Your
on, and
parents
how
in transit?
in not just in transit, but overall in the system of benefits and the different administrations. Everyone in my family is a civil servant. I'll tell you that much. I have UFT, DC 37, all types. Everyone is a municipal worker, and now me, I'm a TW 100 member. And what's important to me is that everyone understand that how we interconnected we are as municipal workers. We're all interconnected to each other and to each other's lives. So when things like this happen, Medicare Advantage is something that affects everyone. And I didn't know that because of Marianne's work. My dad was diagnosed with cancer last year, and he was able to get the treatment he got because of her work, because of her suing the city and her organization, New York Organization of Public Service Retirees. And now, come and behold, they come around and they take the same thing and try to put in the same benefits to us. So I tell all the transit workers that are active or not active that don't know about it, donate to the Transport Workers Union, not the Transport Workers Union Retiree Association, but the TWR 100.
Right.
Okay? And the New York Organization of Public Service Retirees. This is all interconnected. We live in one world. And when they give the money to the profit companies in order for them to make money off of healthcare and off of people, who's going to pay for the healthcare? Somebody still has to pay for it. And guess who gets left holding the bag? The employee or the retiree? If my dad didn't have traditional Medicare, I don't think he would have made it. He would have not survived. He would have not gotten the treatment that he had to get.
How's he doing now?
He's doing better. He has good days. He has bad days, but he's not in the hospital, in a hospital bed, not knowing if he's gonna make it.
But he's getting the treatment.
He's getting the treatment he got. He got the emergency radiation, not radiation. He got the emergency treatment that he needed. He needed 10 sessions of radiation within a 2-month period. Okay? Each session is $80,000. $80,000 for each session. And they say if he would have gotten it as an outpatient, he would probably have to wait in between the sessions. He would have not made it through to this day. And I really appreciate, organizations like this, because I want to make it clear, none of the people here get paid for their work. They're all volunteers. They all do it from the kindness of their hearts. And when I found out this was happening, that they're picking the pockets of the elderly and the seniors, that really bothered me. You know what I'm saying? That really bothered me. And when you let somebody on your bus, right, an elderly person, and the elderly person, you're going to work 30 years, 40 years for this country and in this transit, knowing that they gave up holidays, time with their kids, time with their families, and now you got them spending time fighting the system, is a gut punch. Now you take them and you throw them out out of the bus, and you leave them on their own. You wouldn't do that, right? because the way I was raised was you help your elderly and you help each other because it's a community. This is all one community. Whatever you do affects everyone. You can't say, "Oh, we're just gonna mess them up and it doesn't affect us," because Medicare Advantage is draining the Medicare fund. They drain all the money out. So when it comes time for us active employees to get Medicare, there won't be no money there. You understand? Because they
What he's referring to,
Yeah.
what Celso's referring to is that Medicare Advantage gets paid more money. And traditional Medicare is called fee for service. You go to the doctor, Medicare pays the bill. Tomorrow you go to another doctor, Medicare pays the bill. Medicare Advantage is privatized Medicare. What Medicare does is it pays Aetna a specific amount of money, about $1,036 or $1,055 a month,
Right.
to administer Medicare for them. So now already off the bat, just coming out the door, over $1,000 a month just to administer your plan. That's not even you going to the doctor, but Aetna has to then take care of those bills. Then what they're doing is Lloyd mentioned before that phone calls are starting to come to retirees. Hey, I'm Etna. I want to come over your house and talk to you about a healthy home visit. They're going to give you a little gift card for coming. They're coming because they want to talk to you about your history to then claim that you were a higher risk to them to go back to Medicare and ask them for a higher capitation rate, more money because you were a higher risk. Now they're talking to you. They're seeing that maybe 9/11 responder, maybe you had a past history of cancer, maybe you have some other medical problems. They're going to say you're a higher risk because they want more money. Then the denials and delays and denials of care. In some of these Aetna Medicare Advantage contracts or at Medicare Advantage contracts, there's a honeymoon period, meaning they're not going to deny you benefits for a specific period of time because they want to give you that sense of security so you don't complain, you don't make a complaint to the customer service line, you don't jeopardize their star rating. You tell everyone, oh, look, it's not that bad. There's no problem here. I went to the doctor. There's no denial. It's actually in the contract that it would say that. So this is why they make more money doing that. Even brokers make more money selling Medicare Advantage plans than they do a supplement to Medicare. So that's kind of what he's trying to explain to you.
I just want to add one thing about the prescription coverage. Get phone calls from people where they would get their 90-day supply of medication for $20. Well, they changed it. Most of the calls that I'm getting, one young lady, eye drops for 30 days is $157. They don't give her 90 days anymore.
Yep.
30-day prescription, $157.
Out of pocket. That's the out of
do
pocket.
that to people that are retiring.
Guess what? They do.
Yeah, they do it.
They're doing it.
And it's getting worse. It's not. I mean, as time goes on, it's going to get to more and more people, and the actives have to understand it's coming their way.
Yes.
Real soon. And believe it or not, don't wait until it's too late. We need to get on top of this now before it gets too far gone.
Mm-hmm.
I'm glad you guys did this show tonight. And now you're believers.
and I wanted to
I
add
definitely
my cynical laugh. I'm
so
sorry.
where do we go from here?
We fight this in court. We continue to fight
it in court.
But however, I want people to.
And for those of us that are just starting to learn about these things, what can we do?
We should just keep having these kinds of podcasts out there, these messages, and getting it out as much as possible. You know, the big problem, Lloyd, we've all spoken about this, is getting it out to our retirees. Many people are not on Facebook. They're not on computers. They're not on social media. We have absolutely no way to get a mailing list out of who are the retirees. We'd be thrilled to stuff envelopes and mail them out to let people know
HIPAA, right?
we exist and we're here.
You can't get that
So
information
we
out.
need to get this out as much as we can. Like, if somebody has a connection on a new, Fox 5 or something.
We also want to make it clear that the retirees started the independent owned association. The official association does not want to cooperate or will not provide a list. That's the most important thing that we have to understand. So it's like all these people are fighting. They started it from scratch. I remember when they couldn't even they didn't even have a lawyer. We didn't even know what was happening. We were lost. We didn't know how we could approach it, and it was like a difficult. What do we do now? It's going through, and they bamboozled and tricked the active members to vote and agree to this, not knowing they were handing almost $1 billion to the MTA, maybe more. You understand? And that's what people have to understand. The active employees, that they're handing a lot of money to the MTA and to the union, because gain sharing used to be something that we would get in our pocket and it will go into our wallets as active employees. Now gain sharing goes straight to the union and goes straight to the MTA. They share in the pot of making us come to work every day. And that's when we connected to the active employees, because we have a card in our pocket, and it's the same company that provides active employees the coverage, the same exact company. So you think they wouldn't do that to us in a heartbeat? What deal would they cut next? And what got me upset was when I read Marianne's affidavit, and it said that they never even read the contract, didn't even do research. You're in charge of an organization of 47,000 people, and you have $36 million.
Every I think it's every 2 weeks they get that money.
They get that money guaranteed, and you did not thoroughly read every document that was presented to you by the MTA, knowing how crooked they are and how they do things.
Well, let me just say this. They're just as crooked. The union is just as crooked as the MTA. Most unions now in New York City are giving their members, selling their members out.
Right.
For this Medicare Advantage. Most of the unions are doing it.
Yes.
They're getting big pockets.
So don't think that we're the only ones. There's a lot.
Yes.
Yeah.
And I want to say this too. Don't say the union. It's the union leadership.
Yeah, right.
You are the union.
Right.
You can take back your union. It is the leadership that has fallen on the wayside. This is what we have to keep clarifying. Where are we today? Our New York City retirees, we're fighting our fight. We're helping retirees like Lloyd fight their fight. This group, you guys are TWU active workers. I am so excited to see that, because when we started our fight, we didn't have active workers listening to us. You guys, I'm so excited to see that you're paying attention and sharing this message and going through some of our videos to understand that Medicare Advantage is a diminishment of your benefit. You were promised that your benefits wouldn't be diminished. Medicare Advantage has a network. Not all doctors or hospitals accept it. You have prior authorizations, which you don't have in traditional Medicare. You have to use their drug plan, which if you are on traditional Medicare, you can choose a drug plan on the marketplace if your union didn't provide one for you. This is crazy to give up all of that benefit for like a couple of free perks that most people wouldn't really even want or use. This organization, TWU100R, needs your support. They need people to join their email list, go to their website, go to their Facebook page, make a donation to them so that they can keep paying their lawyers. They've got court coming up. There's going to be appeals. If you guys are going to fight a case that's going to be like ours, Transit is probably going to appeal. If they lose, they're probably going to appeal just like our mayor did.
Again and again and again.
Yes.
And they're not using... And I just want to let people know they're using top guns. They're not going over there and saying, "Oh, we're gonna get the use our lawyers." No, they're hiring top guns. They know that there's something that they're making a lot of money off of the retirees and
which is anti-union. Also, Proskauer is anti-union.
Yes. And Neil Abramson, who is the lead attorney on this, I have to tell you, is extremely sharp. Very smart, and he gets paid the big bucks because he's going to take every dirty tactic he can find and use it against all of us. And it's sad because, again, as I told you from the beginning of the show, I'm a management person, but I understand how the game all goes, and not a transit management person. I come from the theatrical world, and but they are going to fight extremely dirty, and we need to be ready. And also, just so the actives and the other people know, Lloyd, Anita, a few other, Rick, and a few other people in the group, plus my husband and a few others, the union has already put out a lovely flyer, which we don't know if it's in depots or whatever, basically saying that we are running a scam and we are pocketing all the money that's being collected, and everybody is a loser that's in this group.
Right.
You know, it's a badge of honor, but it is horrifying. They're afraid, but they also took information out of people's personnel file and distorted it and posted it.
Yes, they
Yeah.
did.
Yes,
Yes.
and misinformation.
And misinformation. So people are thinking this is, you know, a little group. We're all scamming everybody because this is such wonder. And they have, you know, it's because Lloyd and John and you know, Celso, you're active, but for the retirees that, you know, you have a grudge against the union. That's BS. You worked your butts off for them for your whole life.
We built the union.
Right.
Yes,
And
you did.
Exactly.
And you suffered, and how many of you were assaulted? How many of you, you know, had to put up with nonsense and management stuff, and you didn't sleep, you didn't see your family? Well, you know what? You thought you did it because you wanted the payback when you retired for your pension and benefits.
And we
But
say
never
this,
taken
you're
that
not
away.
anti-union, you
Right.
are union.
Right.
Right.
The reason you are is look at what you did. You organized retirees. Retirees weren't organized. When you retire, you go off into the sunset and you're supposed to live your life in peace. This wasn't peace. You came back, you organized a group, you're doing letters and calls and breakfast meetings, and you're organizing. You're doing what you were taught to do as a union person.
As a union. That's right.
Right. There you go.
And that's the main important thing that I want to recognize, the connection between the retirees and the active. We all have to give $5, give $1, give $2, whatever you can to help this cause, because eventually they're going to come after us. They're already coming after us with the workers' compensation, that we only allowed to use their doctors. And if we get assaulted, we only allowed to use their doctors. So when they come on the news and say, oh, we're doing the best we can for people, but they're allowing us to be rolled over and to be not covered. Our bodies and our health, we cannot get it back. It's a one-time shot. It's not something that you can buy. It's something valuable. And these retirees were there during September 11. Remember that. These are the retirees that went on strike. These are the retirees that were in Sandy. These are the retirees that held this city down and this state down, keep it from collapsing in trying times. You understand? And I want people to understand that no matter where you are, please donate $5, $10. And it doesn't matter if you're a Democrat, Republican, or any other party or affiliation. It doesn't matter. This is a human thing. Everyone deserves their health care, and especially retirees. Thank you for your time, and that's the time I have to give to you all. And I appreciate you all. Thank you. And there's a lot of people that are fighting behind the scenes that you don't see front and center. But there's a lot of people involved in this, and it's growing bigger. And I'm happy that we went from a few people to a few hundred people, and hopefully it keeps growing and expanding.
Keep growing.
And people keep knowing the truth, and people realize that stop lying to people, join the fight, and fight to get the benefits back for these retirees that gave their lives 40 years, 30 years of service. Would I make it 30 years or 40 years of service? I don't know. I might make it to past tomorrow, but I know that.
You never know. You never know.
You never know.
I got a question before because we actually at the hour mark now.
Yeah, we gotta go.
But I got one last question. Maybe Marianne, you could, or anybody can. But I know Marianne, you've been doing this for how long again?
3 years next month.
3 years. My question is, if this plan is as bad as it seems, why would the union push this on its members?
Well, that's a really good question. Well, there's two reasons. One, they were told if they did put the retirees into this Medicare Advantage plan, that they would get a raise. Active workers would get a raise. And why would they encourage the union to do this? Because right now, your supplemental plan that they were paying for, that CPPO plan, that the plan that pays that last 20% that Medicare doesn't pay. So in a quick minute, Medicare pays the first 80%, your supplement pays that last 20. That little plan that they were paying for was $250 a month a person. They didn't want to pay that anymore. Aetna offers them the Medicare Advantage plan basically for free. And so it reduces what the expense to the agency and putting you all on managed health care. So now they're no longer paying, MTA is no longer paying the supplement. That's cash that they freed up that the union could use for a raise, which was valued at about $72 million a year. This was a 3.5-year contract. So now you're in the hands of Medicare. They are administering your health benefits, your Medicare and your what would have been your supplement. So now you've got this one wrap plan that they have to now administer your health care. You go to the doctor. How are they going to make money? If you go 100 times a month, they're not going to make money. They have to permit you to go through a prior authorization procedure where they can delay or deny those prior authorizations. Aetna has one of the highest prior authorization denials at about 13-14% than any insurance company. So they did it for greed. Now, the unions, I'll tell you, in my conversation, both Tony Otano and Richie Davis told me that they didn't read the contract, that they were told by the insurance company it was a better plan, that it had perks and benefits that traditional Medicare didn't have. I literally sat with them for almost 2 hours going through all of these documents with them, showing them that was not the case, and they still wouldn't walk it back even if they could. So wow. I think that they believe the insurance line. They didn't do their due diligence. I don't know what. I mean, it would be wonderful if they can come on and actually answer that question, but that is why it was money.
No, that's never going to happen.
Can I ask a question also?
Sure.
If an agent comes to you and wants to sell you something, a pot of gold or a box full of bricks, will you open up the box and check what's inside the box? Remember in the old days, they used to come around and
TV.
With the TV, they had a brick in it.
The VCR.
Yeah.
Gotta sell it quick.
That's so quick, and you watch the guy run down the street. You know there was nothing in that box.
Yeah, that's what we always say, man. We're New Yorkers. Who would do that? That's a taillight guarantee. Jeez.
I've seen it happen at Fulton Plaza. I got one quick thing I want to say. If there's any OA operators out there watching this, I'm from the OA, Kingsbridge, ex-chairman. Come on, guys, you got to dig in your pocket. It's going to affect you right down the road, just like it's affected us now. Make the donation.
Okay.
All right, folks. So we're at the end. We're at the end of a show today. Like I said in the beginning, I know this was going to keep going. And you're all welcome if you want to do this again next week. At the top of the hour, 7 o'clock, we come back here, continue this. If you have other people you want to bring into the panel, by all means. I mean, we could have as many people. We could have about 10 on here, but 10, if we have even more than that, just take turns, bring them in, bring them out.
And, I have a question.
Yes, sir.
Can you edit out my sensitive moment at the beginning?
No.
Lloyd, that has to stay. That's
I am making a promo video with just that.
You're gonna get 1 million hits.
Yeah. We're going viral. Thanks, Mr. Archer.
If retirees have questions about the plan or anything, please email the TWU100R@gmail.com, and we will all try to answer as many questions as we can.
Yes.
It's hard to do it on, the Facebook because it's very complicated. But I have given my phone number and information to Lloyd and Anita and Julio. And I'm happy if somebody wants to reach out to them and have, I can help you with your benefit claim or work through Aetna. Just reach out to them and we'll get back to you.
And share and like the show and break the algorithm of the company. Share it like you never shared it before. And block.
Yeah. Say it again, bro. Say it again.
Exactly.
Say that again.
Share it spread the word to everyone. Text it to people. Put it in your Instagram. Put it in your Twitter. Put it in your any platform you can put it on. Share it like they've never been shared before. These guys are going viral because they're doing the right thing, and everyone here is doing the right thing. Make it go viral for the right reasons, and let the people know that the power is in the people, not in anyone else but the people.
Solidarity.
Yeah.
Joe Figueroa.
Retirees strong.
This is live right now, Joe, and it's on our Facebook page, Sutrans and Misfits. It's on our YouTube page. It's not going nowhere. It's there. It's there. So you could go into our Facebook page and share it from there. You could go into our YouTube page. We don't bring it down. Every single show that we do when we go live
Always
stays up.
Excellent.
Stays up. So all you gotta do is go back after this is done. Like Blunt and I think we both, right after we're done a show, we go back and we rewatch it. I'm definitely gonna be rewatching this because there was just so much information here that I usually watch it to see how many screw ups Blunt and I did, and that's what I go looking.
Fantastic.
You know? But this is something that is worth watching over, and not just because it's our show, but I'm definitely going to rewatch this probably tomorrow on my swing because it was important. Is that important? So please share this out. Again, we went over an hour. We will welcome everybody to come back next week. If you have other people, you know,
I have a lot of reading to do. I only got through a couple of paragraphs of the document.
I got to look at that too.
I really got a lot of reading to do.
You got to read it.
A lot of reading.
It's very deceptive. And when you get into the EOC, then you see it's reality. And you're like, oh my God.
I got my ace number 1 by me, so I'm happy.
You got
so everybody, one last word from everybody that want to say, you know, you want to post something, what do you call it? Plug a page or something. Start, Mr. Garcia, start with you and work our way.
Me?
Well,
I'm sorry, Celso.
I've been very disappointed politically this week with a lot of people that don't understand the vision, and not everyone's a visionary, and not everyone can see. Even though my eyes are low, I have a big brain, and that's what counts, and that's what we all need to do our research, study, and push forward, and not count on other people's word to tell us stuff, but actually read and dig deep, and dig deep into your pockets and make this group be successful. Okay, thank you. That's my last word.
All right, let's move on. Oh, I gotta roll over here. Mr. and Mrs. Hackett.
Yeah. Just want to say, everybody, please support as much as you can. This is your life. It is important. You don't want an insurance company making decisions that could kill you. And it could, because they're only worried about their bottom line. So get out there, support us, pass the word. This is reality. And one day, for all you actives, you're going to be in the same boat, if not worse.
Join the
All right,
fight.
thank you for that. Mr. Archer,
Hey,
you good? You good?
Yep.
I'm good. All I'm
Got
going to
tissue
say
over there?
donate, please donate. And thanks for listening.
Yep.
Thanks for the phone calls, the emails, and we'll be having a meet and greet soon where we'll let you know. We want as many people there as possible.
Definitely. All right, and last but not least,
Marianne.
Well, thank you for inviting me to join you guys. It was wonderful.
Thank you for coming.
Thank you.
I want you to all have faith, because we are basically fighting the same fight, New York City retirees and transit retirees, and we are with you and we have your back on this. We're sharing as much as we can. Know that we've won our case, our city appealed, which is a good indicator, hopefully, that you will win too. Have faith in your attorneys, have faith in your team, donate to TW100R. That way this fight can continue and they can fight for you. So keep this message going, actives and retirees. Together we can fight, we can win.
Thank you, Marianne.
Thank you for everything.
We're really thankful for you coming here, because I really didn't think we had somebody of your caliber to come on our show. So I appreciate you, Ms. Marianne, to come on here. You're like a top dog on YouTube, so we appreciate you coming.
I call her the Wonder Woman.
She is Wonder Woman.
She got Wonder Woman right up behind her up
Yeah,
there.
yeah, I see that right behind her, right there. Right?
That's right. That's right.
Wonder
She is
Woman.
Wonder Woman.
She's
you
holding
go.
a number 7 train.
There you go.
Jeez, that's strong. That's strength right there. So thank you everybody for joining
you.
us.
Thank you,
It's
guys.
great.
Thank you.
Thank-
Definitely
I
see you
hope
next week.
Again, we could do it again. Just let
Yep.
us
Yep.
know. Anybody that's watching that wants to join the panel, let us know. Blunt, anything else you got to say before we go?
No, thank you guys for coming. Appreciate it. It was
Thanks
been
for having
real,
us.
Thank you.
real eye opener. I hope this thing goes viral as it needs to. We got what 30,000-40,000 transit workers.
Yes.
I hope each and every one of them watch this because it's so important. It really
Yes,
is.
sir.
And I thank each one of you guys for. I know that this is not easy to go against the grain like this,
Mhm.
but it's so important, and I'm glad you guys are actually doing it. So thanks for coming on.
Thank you.
All right,
Yeah.
so okay.
Okay.
We'll see you all next time, folks.
See you
See you
next
next
week.
time, next week.
Have a
Everybody
good
have a good
night.
weekend. Good week. Stay safe.
Do we
Stay safe.
end the way we end, Blunt? Do we end the way we end, or
Always.
always? So with that said, I'm Brooklyn Pete,
I'm your boy Blunt.
and that's the end of our show.
Fuck them if they can't take a joke.
All right.
Yeah.
Amen. Yeah.